everyone, I'm Dr. Lisa Medaglia, also known as Dr. Lullaby. Today we're going to talk about nightmares. A nightmare disorder is diagnosed as a patient having 3 or more nights a week where they're experiencing nightmares, and it's happening for at least 3 months, and it's causing some kind of accompanying distress or dysfunction. So let me first start by talking about what nightmares really are. A lot of people think they have nightmares, but they might actually be something else. So nightmares are when you experience almost kind of like a horror movie in your mind during dreams. They're terrifying, and when people wake up from nightmares, they're afraid to go back to sleep. Sometimes people are having such bad nightmares that they're afraid to go to sleep. So insomnia can be present with nightmares because it causes this long nighttime awakening and prolonged sleep onset latency. So they differ from what are called vivid dreams or anxious dreams. So sometimes when people are experiencing stress during the day or anxiety during the day, their dreams are a reflection of that. So they might have kind of dreams that are negative in nature or have a negative emotional tone to them because that's how they're feeling during the day. So they might wake up feeling stressed or anxious or bothered by what they dreamt about. Those aren't necessarily nightmares per se. So nightmares are typically something, especially nightmare disorder. We'll often find that patients with a nightmare disorder also have some kind of history of trauma. So sometimes physical, sexual, emotional abuse, or experiencing or witnessing some kind of traumatic event. And so patients that have had history of trauma and have any post-traumatic stress symptoms, we always want to recommend first that they're working with a therapist or psychologist on management of those symptoms, and then we can consider kind of going into work on the nightmares if the symptoms of PTSD are kind of improved or resolved. So working on nightmares, it's not easy work to do. We use a technique called rescripting, where we kind of identify the parts of a nightmare before things get bad. So we kind of identify what we call a hotspot. So it's that point before a dream turns into a nightmare. And for a lot of our patients who have nightmares, they say that really it feels like the whole thing is a nightmare. But they're able to, if you really kind of look at them closely, you're able to kind of identify maybe just some starting points. So for example, I was working with a veteran who was explaining that his nightmares were related to his military time in Iraq, and he was having nightmares about bombs going off, and he had lost a friend during one of the attacks. So he was able to identify this time period in where it was still a dream before it turned into a nightmare, where he's just kind of walking with his buddy, walking with his friends, kind of on a street and on a path. And that's kind of the beginning part of the dream. And then he hears a loud sound. So that loud sound's that hot spot. So we were able to take the remaining parts. So kind of where it turns into a nightmare, this part where it is a bomb and he loses his friends, and change it, rescript it into something else. So he, heard a loud sounds and looked over, and then it was all of his friends and they were at a barbecue. So you kind of use your imagination and come up with a different ending. And then the key is to kind of rehearse that new version, that rescript over and over in your mind during the day and then maybe before bed until it infiltrates or takes the place of the nightmare. So rescripting is a really powerful tool to use for patients struggling with nightmares, but it's always important that our patients who have history of trauma, that they are working with a therapist or psychologist and trying to manage symptoms before they get into the nightmare work. And also remember that nightmares are different from anxious dreams and vivid dreams. So if you are having anxious dreams and you're waking up kind of feeling anxious or stressed, take a look at how you're feeling during the day and make sure that you're optimally managing stress and anxiety. That's probably your best chance of seeing less of those anxious or stressful dreams if you're able to manage stress and anxiety during the day. Thank you.